Good morning and good afternoon, everyone. Welcome to our 26th anniversary Healthcare is About Domestic Violence Day webinar. Today, we'll be talking about integrating domestic violence into emergency preparedness planning and response. This webinar will be offered as English with Spanish and ASL interpretation. And I will pass it off to you, Andrea.
Thank you, Kennedy. ¿Qué tal? Buenos días a todos. Bienvenidos al 26 aniversario del Día de la Salud contra la Violencia Doméstica, en el que la presentación de hoy será cómo integrar la violencia doméstica en la planificación y respuesta ante emergencias. Vamos a proporcionar instrucciones sobre cómo escoger su canal de idiomas en caso de que quieran escuchar en español. Okay, so I will briefly provide this instruction for people who want to listen in Spanish. So let's go on to the next slide, please. All right, so if you're joining through a computer and you wish to listen in English, you may not do the selection, or you can also go ahead and locate the globe icon that says interpretation at the bottom of the screen and select interpretation and then English. En su computadora, en este momento puede ver un icono de globo terráqueo que dice interpretación en la parte inferior de su pantalla. Por favor, ubique el icono y selecciónelo para escoger español. Okay, and we'll go on to the next slide. Okay, so once you choose English, please make sure that you do not mute original audio so that you can hear the main room. Y por favor, si usted selecciona español y solamente desea escuchar el audio de las intérpretes, usted puede seleccionar audio, silenciar el audio original y de esta forma solamente va a escuchar al intérprete. Okay, let's go on to the next slide. And if you're joining through a smart device, such as your phone or your tablet, please tap lightly on the screen to bring up the three-dot menu and do the same selection, just select language interpretation and then English. Si se está uniendo desde un dispositivo inteligente, busque el menú de 3 puntos y elija interpretación. Después elija español. Y de nuevo puede silenciar el audio original para no escuchar el inglés en el trasfondo a un nivel reducido. Okay, and I may have one more slide. Okay, I don't. Okay, so just make sure that you click done written in blue letters to activate the interpretation selection. And we also remind you that there is American Sign Language interpreters on the screen visible at all times. Por favor, recuerde terminar su selección de idiomas al oprimir el botón de listo o done escrito en letras azules para que pueda activar su selección. Si no nos escucha o tiene algún problema con la tecnología, por favor nos puede avisar en el chat. Una de nosotras le asistirá y en pantalla a todo momento podrá también ver a las intérpretes de lengua de señas estadounidenses. Okay, back to the host. Thank you.
Thank you so much, Andrea. And just a reminder that caring for others starts with us. It's important to remember that there are survivors among us. Self-care is important. Care for each other and lean on supports. On this webinar today, we have a multitude of individuals from primary care associations, public health networks, health center controlled networks, domestic violence, sexual assault, and human trafficking coalitions, community-based advocacy programs, and national organizations, as well as academics, community health centers, and people from the Department of Health. So thank you all so much for your participation in Healthcare is About Domestic Violence Day and your commitment to supporting survivors. Next slide, please.
So welcome, everyone. My name is Virginia Duplessis, and I work with Kennedy at Futures Without Violence. I serve as the director of the National Health Resource Center on Domestic Violence. We're so thrilled to act as your faculty today. We have many wonderful guests who are joining us to talk about their work on the ground, um, really helping to integrate domestic violence into emergency preparedness planning and response. So I'm going to tell you just a little bit about the National Health Resource Center, and then Kennedy is going to introduce herself and talk about the project she works on. Next slide, please. So the National Health Resource Center on Domestic Violence, which we call the HRC, is a federally designated resource center that really helps to improve the healthcare system to do a better job at preventing and responding to violence. We also do a ton of work with the advocacy community so that domestic violence programs can increase their capacity to address survivor health needs. And today, we really come together as two united fields to work together on this really important intersection of emergency preparedness, planning, and response. If you'd like to learn more about the National Health Resource Center, you can check out IPV Health, which is kind of our one-stop shop website. And we have a ton of free resources, which we're going to talk about a little bit later at our store.futureswithoutviolence.org. And I'm going to hand it over to Kennedy to introduce herself.
Hello, everyone. Nice to meet you. My name is Kennedy Pratt McLeod, and I am a program assistant at Futures Without Violence, working on our health partners on IPV plus exploitation project. And you can go to the next slide. Health Partners on IPV plus exploitation is led by Futures Without Violence and funded by HRSA's BIPIC to work with health centers to support those at risk of or surviving intimate partner violence, human trafficking, and exploitation. We also work to bolster prevention efforts. We are on the 6th year of our project, and we're very excited to provide technical assistance and training such as the webinar today. Next slide, please. Today, we will have a brief overview of content we shared in our September 23rd Emergency Preparedness webinar, followed by presentations from our 3 featured speakers, Sarah Hicks West, Deborah Ward, and Rebecca Melendez. Afterwards, Virginia will facilitate our panel conversation, which we will follow up with some key resources and tools for you to utilize in your emergency preparedness planning. Afterwards, we'll launch our evaluation poll and share some of our upcoming events. As a reminder, the learning objectives for this webinar will be available on Health Partners on IPV plus exploitation for your review. Next slide. Building partnerships between domestic violence coalitions, primary care associations, and domestic violence programs / health centers is a crucial component of promoting safety for patients as well as staff. Today, we will talk about the benefits of these partnerships as well as supportive resources to promote new or expand upon current collaborative efforts. So let's look into some opportunities to promote prevention, intervention, and referrals. Next slide, please. Thank you. Everyone has a unique and important role in supporting survivors of intimate partner violence, known and unidentified. You don't need to be an IPV expert to provide support. Let's consider IPV experts such as survivor service agencies, IPV support services, domestic violence advocacy programs, community-based organizations as our partners in this work. These programs can fill the gaps of services that are outside of our scope of practice and expertise, including safety planning, housing and shelter services, financial empowerment, employment support and skill development, and more. Referring people to organizations in their community is really powerful. The IPV support services are vast. There are over 1,700 victim service agencies in the country, including those that serve Alaska Native and American Indian communities. Most counties have one, sometimes more than one. Knowing the services and supports in your community is critical. Learn about the resources in your community that can support your patients and consider ways to build relationships with them so you can make warm handoffs to folks you know and trust. Next slide, please. Partnerships are important for patients and staff. They can provide assistance with domestic violence and safety planning. It can help with increased health enrollment by facilitating health enrollment for clients, staff, and their children, regardless of their current health status. And by establishing a primary care provider, it can help move patients away from emergency level care by helping them establish a primary care provider. Key partners include health centers and primary care associations, local domestic violence programs, coalitions, and civil legal services. Next slide, please. Health centers are community-based and patient-directed organizations that deliver comprehensive, high-quality primary healthcare services. They provide services regardless of patients' ability to pay and charge for services on a sliding fee scale. Health centers also integrate access to pharmacy, mental health, substance, and oral health services in areas where economic, geographic, or cultural barriers can limit access to affordable healthcare services. There are 52 primary care associations at the state, territory, and regional level that provide training and technical assistance to health center members. On this slide, you will find links to find a health center tool, which identifies health centers in your area, as well as a link to the Primary Care Association directory, which will help those find state, territory, and regional partners who can also direct you to local member programs. Next slide, please. Many domestic violence programs operate 24/7 and include the types of support listed on the slide. In many communities, domestic violence programs serve as primary referrals for both domestic violence and trafficking survivors. In fact, for many survivors of trafficking, they may contextualize their experience within the context of relationships. Most domestic violence advocacy programs have the know-how to work with and support all survivors through immediate and long-term safety planning and help increase survivor awareness of the unique legal and housing supports available to them. Next slide, please. On this slide, you will see the National Domestic Violence Hotline, which is a resource for everyone, and it's especially important in the case of emergencies or disasters. The hotline is 24/7, confidential, utilizes a language line for interpretation, offers web chat, and text capabilities. The hotline has been partnering with HRSA-funded health centers for years and has been training health center staff about their safety planning services. They also refer folks to health centers for care and provide information on their website. Next slide, please. The Strong Hearts Native Helpline is a 24/7 safe, confidential, and anonymous domestic and sexual violence helpline for Native Americans and Alaska Natives. Strong Hearts also partners with the National Domestic Violence Hotline and National Indigenous Women's Resource Center. Staff at the National Domestic Violence Hotline and the National Indigenous Women's Resource Center developed a program concept for the Native American Hotline run by Native advocates to support tribal communities, which resulted in Strong Hearts. Next slide, please. On this slide, you will see the National Human Trafficking Hotline, which provides 24/7 support and a variety of options for survivors of human trafficking to get connected to help and to stay safe. The trafficking hotline can communicate via phone in more than 200 languages, as well as text, web chat, email, and web form in English and Spanish. Next slide, please. On this slide, you can see some examples of partnerships with community organizations that expand basic need supports for patients that can help prevent human trafficking, such as food banks, career services, housing organizations, domestic violence programs, or legal aid services. Next slide, please. On this slide, you will see an expanded version of partnership benefits at the local level. These partnership benefits can support health center staff and patients, and as a complement to these points, the benefit of primary care association and state domestic violence coalition partnerships is that there is an integrated engagement across the state. State and territory organizations can work together to promote state and territory policy and system changes for their health centers and domestic violence programs. They can connect local health centers and domestic violence programs to work on healing center practice transition. There's an ongoing integration of intimate partner violence and human trafficking response into the healthcare delivery, and of course, emergency preparedness collaboration. On this slide, you will see links to our tools for increasing healthcare remote enrollment for survivors of domestic violence, as well as a tool that will assist with building partnerships. Next slide, please. On the slide, you see our English and Spanish Memorandum of Understanding, which will help establish a formal working relationship between health centers and domestic violence programs. Next slide, please. On this slide, you will see the Adaptable Health Center Protocol, which is also available in English and Spanish. This protocol will enable health centers to provide survivor-centered care, intervention with clinical and case management services, and formalize ways to connect patients with community-based services that provide resources for domestic violence, employment assistance, housing, food, and other basic needs. And now I will pass it on to Virginia.
Thank you so much, Kennedy, for reviewing some of the material that we covered on our previous webinar back in September. So now we invite you all to enter into the chat if you have any questions. And also, in the spirit of really hearing about what the field is doing for Healthcare is About Domestic Violence Day, naming one action that you can take to really build or expand on your partnerships at the local or state, territory, or tribal level. I think, so much of what Kennedy covered in her presentation is that we can't do this alone, right? And so it's going to take a village, it's going to take those partnerships so that we can best meet the needs of survivors and, of course, work together to prevent violence from happening in the first place. So I'm going to leave just a couple seconds to see if anyone wants to add in the chat. Let's see any questions that come up. Having strong community partner engagement is super important. Yes, definitely want to make sure that you have the supports in your community to be successful. All right, so we've got one commitment. That's great. Building relationships before a crisis occurs. Exactly. Today is really an opportunity to hear about some resources and some strategies that you can try out in your communities while things are relatively calm. Roundtable with organizations in the community. Yes, that's a great idea to bring people together, figure out what your shared values and commitments are. Participating in health fairs, excellent idea. Really thinking about what are events already happening in the community that you can participate in to make sure that folks know about the work that you're doing and how the work of your partnership can benefit. Community partnerships, cross-training, lunch and learns. People love a lunch and learn. Food. Rebecca's going to talk a little bit later, one of our guests, about her Healthcare is About Domestic Violence Day activities. And one of them is they make cookies for everyone in the hospital, and that goes a long way. Tabling events, partnering between pharmacies and shelters. Yep, to ensure people experiencing violence are dispensed and received medication. These are all really great ideas. Thanks everyone for sharing. And now we are going to kick off our first presentation by our guests. If we can get the next slide. Sarah Hicks West is joining us from the Phoenix Collaborative, and she's going to talk about her work really to build partnerships for survivor safety during emergencies and natural disasters. So take it away, Sarah.
Awesome. Thanks, Virginia. I'm excited to join you guys here today. I've worked in disaster response and recovery with the American Red Cross, and also with the Cloudburst Group as a technical assistance provider for the U.S. Department of Housing and Urban Development for over 20 years. And during I've really focused my time on sheltering and feeding, ensuring that people post-disaster have whatever they need to begin their recovery. It's really challenging for communities to plan for and respond to populations impacted by disasters that were experiencing other traumas beforehand. And so often we tend to just planning until last or not at all. So it's true in all types of disasters, whether we're talking about natural disasters like hurricanes or public health emergencies like the COVID pandemic. And of course, as you guys are probably very aware, the lack of planning takes a huge toll on our staff, our resources, and the ability to serve our survivors. So I founded Phoenix Collaborative this year to continue to assist communities in navigating that complexity. So planning and preparing and responding to the impacts of disasters, specifically for people who are experiencing homelessness or survivors of intimate partner violence, human trafficking, and exploitation before the disaster. Next slide, please. So not surprising, every disaster increases stress, instability, and isolation. And so we know those are the very conditions that allow violence to escalate. In the wake of the chaos of a disaster, it's easy for our survivors to lose their connections to support networks. Communication systems may be down, internet, phones, or the individuals may be evacuated outside their community completely. So disasters also were not designed for privacy or with particular needs of someone who may be in an abusive situation in mind. And so survivors may have to share space with someone who is unsafe. And our disaster recovery system in this country is really based on property loss. So that often means that an abuser is able to access all of the disaster assistance that's meant for the entire household, which can leave a survivor left to make a very difficult decision whether to stay connected with that abuser to receive resources or to risk their ability to access any real disaster resources at all. Next slide, please. So when we fail to plan for that survivor safety, of course, people can choose to exploit that. So we see harm doers use disasters to reestablish control. We see that them utilize this opportunity to capitalize on the chaos to acquire child custody or to isolate that survivor from friends and family. We also see that there may be delays in the legal processes, such as protection orders or divorces, just because of the court delays and the temporary. Meanwhile, our survivor needs are often sidelined. So without targeted reach or privacy kind of built into disaster systems, they face higher food insecurity, housing instability, and financial risk. Next slide, please. So with all that said, let's talk about what we can do about that. So one of the biggest, and I think you guys have already mentioned this in the chat that Virginia pulled out, is the greatest thing we can do is build these partnerships ahead of the disaster. So those might look like with emergency management, Red Cross, continuums of care, and housing services providers, of course, and also local domestic violence providers. Emergency and healthcare work within this incident command structure within a disaster, and that structure is very different terminology and language and processes to our victim services providers. So building these relationships ahead of time brings the survivor needs front and center, connects with similar language, and helps us define those roles and hold each other accountable. We also want to integrate survivor safety and privacy planning into every step of the emergency plans and include our victim services providers in that planning process. We need to be working with survivors to think through what documents they need if a disaster happens and they have to flee quickly, if someone's quarantined or sheltering in place with their harm doer, who's in their support network, how will they stay safe in a last-minute evacuation, and what happens if a domestic violence shelter is needed or when survivors must enter congregate disaster shelters. Are our partners ensuring survivor confidentiality and compliance with the Violence Against Women Act? This is an opportunity to use your authority, advocate for those survivor protections, and also for flexible funding for providers. We've heard that providers want to be involved and engaged and work on this planning and response, but everyone is stretched thin. And without dedicated funding and resources, they just don't have the bandwidth to take on additional work. And believe it or not, the disaster response community has not all been trained in trauma-informed care practices. So this is an opportunity for healthcare to bring that model into community trainings and disaster exercises and really create a ripple effect within the disaster response community. Next slide, please.
I'm going to interrupt for just 1 second. I think you might be having some bandwidth issues. If you want to turn off your camera and see if that helps.
Yep. Can you hear me better? Okay, great. So one of the most consistent lessons from my years in disaster response is that if we're not at the table before the disaster, we're not likely to be invited when it counts. So building those relationships ahead of time ensures that emergency management understands this is an issue they have to be planning for, to align expectations, ensure survivor advocacy, and healthcare voices are integrated from day one. And ultimately, we'll know who's responsible for what, and then be able to hold each other accountable. Next slide, please. So healthcare settings may be the first and sometimes the only safe contact for survivors during crises. So you have a unique position that includes that authority, trust, and reach within the community. So if we can include survivors of intimate partner violence in our emergency planning now, we can really ensure that when the next disaster strikes, we can shift into this urgent response mode and intentionally ensure survivors are treated with compassion. It essentially becomes muscle memory. So when we build those partnerships and include survivor safety practices in our planning, we can then meet people with this compassion instead of the chaos, and really prevent that re-traumatization that happens during disasters. Next slide. And I really appreciate the opportunity to chat, and I'm happy to answer questions. And of course, I'll be here through the whole process, rest of the program today. Thanks, Virginia, and I'll turn it back to you.
Great. Thank you so much. We're going to welcome into the room our next speaker. If we can have the next slide, please. So we're welcoming Deborah Ward, who is the CEO of YWCA of San Gabriel Valley. I have had the honor of working with Deborah for, over 10 years now. She has worked in multiple domestic violence programs and always brings with her this spirit of building partnerships between advocacy programs and healthcare programs. So I'm going to let her speak for herself about some of the amazing work that she does in her community.
Okay, great. Thank you so very much. It's a pleasure to be with you all this morning and afternoon. Again, my name's Deborah Ward with the YWCA of San Gabriel Valley now for 8 years. And prior to that was with the Genesee Center, which was a domestic violence program in the South Los Angeles area as their strategic director of strategic planning and innovative programs. Um, Just to give you an overview of our organization, we've been around for 90 years. Can't believe this year we're celebrating 90 years of service. Where headquarters are in the city of Covina, and we are all serve over 30 cities and municipalities. And when I mean serve, we have actual city agreements to provide many of our services. Domestic violence and intimate partner violence and our sexual assault programs are married into one through our domestic violence program. Our programs, and we consider them our hallmark programs because we have had them the longest. Have We have been operating a domestic violence program for over or nearly 50 years. And we also have a strong senior services program. We also do a lot around elder abuse and how intimate partner violence impacts an aging community. In this last year in 2025, we were very active with our fire relief and recovery. And then we started maybe 3 years ago a We Empower Center, which we is Wellness, Equity, and Empowerment Center, which is our educational family resource hub here at the organization. Our mission is really centered around eliminating racism and empowering women. We do that by promoting justice, freedom, peace, and dignity for everyone. We serve everyone, including men, although our focus and the majority of our clients are women, but our services are open to everyone. I wanted to show the 90 years. I found it fascinating to be able to go as far back as 1935, when we first started with community women who came together who wanted to do put together services for women. So our shelter program has been one that um, has evolved, starting with hotlines, starting as early as in the 40s, being able to provide housing, safe housing, as well as hotel vouchers for women who were displaced either through violence or through other means. You can see we were very active in providing services to Japanese girls during the 40s. That legacy really helped us to move towards providing greater services, and we were able to get to the point where we were able to open a shelter in 1979, and we've been providing both residential and non-residential programs since that time. The next slide. Our values are really rooted in our commitment, compassion, integrity, collaboration, and empowerment. We incorporate all of those values in the work that we do. All of those values also are integrated into our staff development and training, as well as the clients that we serve. And then as we move to the next slide, you can just see an overview of all the different programs that we offer. I won't go into those. I can talk more as we get into the Q&A section. And the last slide gives you an overview of our DV healthcare partnership. And this program started with us with Futures Without Violence, a grant that was from the Blue Shield, California Blue Shield Foundation. We were lucky to be one of those partnerships. Genesee, that's when I worked at Genesee. The YWCA was a part of that. When those programs ended around 2018, the directors all got together and we wanted to see if we could sustain some of the good work that we were doing. So, in doing that, we put together the DV Healthcare Leadership Council, and you can see that was a real critical group because that became the group that became the think tank around how we can encourage and promote healthcare partnerships. So you can see LA County Public Health Department, Genesee, the East Los Angeles Women's Center. You'll hear from Rebecca soon, as well as the Community Legal Aid of Southern California. Those were the key groups that came together probably about 6 or 7 years ago, and we put on a conference where we talk about best practices around DV and healthcare throughout Southern California, as well as in other regions, the state and national. For the YWCA San Gabriel Valley, I just wanted to highlight some of our key DV healthcare partnership programs that continue to evolve. Our relationship with health centers. You can see 2 health centers that we've had um, a um, a a long time relationship with. That's the Central Neighborhood Health Foundation Mobile Clinic. They actually come to our headquarters where our confidential site clients can come with their children for checkups. That's been a godsend program to be able to meet our clients where they are, especially when they are fleeing um, a um, a trauma and violent relationship, and they have a safe place to be able to take not only themselves but their children as well. East Valley Community Health Center is another one. It was one of our initial health centers that we became partners with. We continue to um, have a good relationship with East Valley and have many of our clients join their health center. Um, Another entity is our educational um, partners. And the San Gabriel Valley is in Los Angeles County, and it has one of the largest university pool of university colleges in this area. We have been able to work with our local colleges to talk about how we can incorporate domestic violence into their healthcare curriculum. So we work with social work programs, nursing, public health programs. These are 4 of our standout agreements that we have: Azusa Pacific University, Cal State University of Los Angeles, and Cal Poly and Claremont Colleges. Sarah mentioned earlier how important it is that you establish partnerships before a disaster occurs. Um, I consider I provided leadership through 3 types of disasters. One would have been the COVID, um, and the second one would have been the Monterey Park shooting. And the third one is the one that we're currently still involved with, the Eaton Canyon fire. And so those are some of the programs that we have worked with. There's 4 other programs that we continue to have like a collaboration that we do collaborative work with, and that's Healthy San Gabriel Valley, where we have educational institutions, hospitals, federally qualified health centers or health centers. We have educational institutions from K through 12, as well as the colleges, primarily the health professional schools. We also work with the San Gabriel Valley Health Consortium, which focuses a lot on mental health, physical health, and substance abuse providers. And lastly, we work with the San Gabriel Valley Economic Partnership, being able to work with our business communities throughout San Gabriel Valley was a critical piece in terms of having a expansive network to educate regarding the intersection between DV and healthcare and other nonprofit and business entities. I think that is an overview. I look forward to answering any questions later.
Thank you so much, Deborah. You bring an incredible amount of experience and such diverse experience in terms of thinking about those partnerships where we can really make a difference. So now I'm going to invite our next speaker, Rebecca Melendez, who is an associate director at the East Los Angeles Women's Center, to talk a little bit about the incredible work that they're doing in their community.
Hello, everyone. Good morning and good afternoon to those of you who are joining us from the East Coast. I am Rebecca Melendez, and let me tell you how lucky I am. I get to do a shorter presentation because Deborah and Sarah covered a lot of the work that we do as domestic violence response organizations, and those of us who provide services in the community often mirror a lot of the same services that are offered. So a lot of what Deborah shared is true. We have a great partnership with the YWCA of San Gabriel Valley. So Deborah, thank you for also representing some of our work here. My name is Rebecca Melendez. I am an associate director with the East Los Angeles Women's Center. A little bit of my background. I've been in the ending violence against women movement for 25 years. I've been a community organizer for 30 years. And so I have a wide range of experience in this topic. But most recently, like many of you, I gained a lot of experience in how to respond under unforeseen circumstances, unplanned circumstances, and unbudgeted circumstances. So it's a little bit about what I'm going to get into with you today. Slide, please. So the East Los Angeles Women's Center was founded in 1976 by community volunteers who established the first bilingual hotline in the nation. Today, we're recognized as a leading voice for thousands of survivors. We provide culturally responsive services specifically for Latino communities in areas of sexual assault, domestic violence, human trafficking, HIV/AIDS, and an array of services that interconnect. A fun fact is that the East Los Angeles Women's Center was the first Spanish-speaking sexual assault hotline in the United States. It began with these 2 women who are here on screen. They were social workers at what was then LACUSC. I believe it was LA County General, maybe. And they saw that the services were needed in our community. They had actually taken the training to become volunteers in another part of Los Angeles and realized, wait a second, our community needs this service as well. And so that's how our hotline was born. Slide, please. This is a picture of our second graduating volunteer class, and it's not really relevant in terms of the emergency preparedness of our organization, but it always makes me so excited when I see this because it really is our legacy. It's such a beautiful picture. And for those of you who are part of the sexual assault movement and are familiar with Alba Moreno, this is also why I love showing this picture, and are familiar with Alba Moreno, Alba was part of our second graduating class in 1979, I believe she says. And she's in the black here in the tank top. So this a fun little tidbit in sitting up, propped up. Virginia, I can see you trying to find her propped up on the counter there. That's Alba Moreno. That's our legacy. And so, when you start there, we're challenged every day to meet up to the strength and to the legacy of these women. Slide, please. Our purpose is to ignite hope in the lives of women and their families impacted by domestic violence. We use a holistic and family-centered approach. We recognize and honor the cultural strengths of the communities that we serve. Women, and more often Latinas, are silenced by fear, social norms, religious beliefs, and gender roles. Together, we help break the silence and help individuals and their families seek help and live in peace. We provide services rooted in positive cultural influences that help families become grounded, centered, and interconnected. We are committed to creating culturally responsive programs that create violence-free lives. Slide, please. Today, I said that we started with the hotline, and this is who we are today. Our services are vast. They interconnect, they intertwine, they intersect, whatever way you want to describe it. But the one thing that they have in common is that everyone that we work with are survivors. We try really hard to stay in our lane, which gives us an opportunity to focus and heal and really just try to figure out what is the best way to serve survivors who are often overlooked and underserved in other areas. So I'm not going to get too deep into this, but just to give you an idea where we are today, we've expanded our organization it is the only shelter that sits on a county medical or on a government medical campus in the country. It's the Hope and Heart Shelter. It's a 12-bed facility. The way that it works is that it's on the medical campus with the hopes that it makes the providers' lives easier. They can call us and get a referral into the shelter. If we do not have bed space at that moment, what we will do is we will work with other organizations like the YWCA of San Gabriel Valley, who more often than not, will assist us in emergency housing, or we'll call one of our sister organizations that helps us figure out what the best option is for a survivor. And then we also have a housing assistance program. Some people are on the verge of losing their permanent shelter. And so our goal is to avoid that. And if we can help them stay within their current home, then then we work hard to do that as well. We are leading the path in the way that we engage men in this work and in healing. We have a youth program that focuses on leadership development and violence prevention. It's not so much an intervention model as much as it is a leadership development model. You may be familiar with our groundbreaking Promotora Institute. We have anywhere between 350 and 400 promotoras that educate the community on the various topics of domestic violence and sexual assault. And all of this, like I said, is built around sexual assault, domestic violence, HIV and AIDS, and human trafficking. Our work at Los Angeles General is notable. Los Angeles General is a campus that houses roughly 10,000 people. And this is how I met Virginia and Futures Without Violence, was through our Blue Shield grant that began 11 years ago. And the grant was a seed for us to be able to go in and begin dialogue and partnerships with the medical campus. We're going to get, I'm sure it'll come up in our Q&A, but we're going to get into how those partnerships have grown over the last 10 years. and how critical it was in the last 5 years when we really, really, really needed to figure out how are we still going to respond to survivors that needed medical attention, that needed support, that needed refuge. And also, where we are today, Virginia said that we make cookies. We, in fact, do not make cookies because that's no. But what we do is we hack cookies. So what we do is we buy cookies at Costco, and I'm going to tell you this real quick. We buy cookies at Costco for Health Cares About Domestic Violence Day. We package them into individual cellophane bags, and we have a sticker on there that leads to our medical provider webpage online. And we hand out anywhere from 600 to 700 cookies on Health Cares About Domestic Violence Day. And the catchphrase is a sweet reminder that you don't work alone. And those cookies probably, this whole cookie, we call it cookie time. Cookie time probably would not have happened 10 years ago. Those cookies are a real testament of how far we've come in the partnership with Los Angeles General Medical Center and USC Keck. And I know that we are wanting to get onto Q&A, and I'm kind of rushing through this, so we can get on to Q&A. Virginia?
I was going to give you credit for baking all of those cookies.
Oh,
And I love, you know what? I wish I had cookies to give to everyone on this webinar today as a sweet reminder that we don't have to do this work alone. And hopefully the presentations have really inspired people to think about new and different ways that they can create these partnerships to address survivor health needs. So I have to say that all three of these presentations stole a lot of my thunder in terms of the panel questions that I was going to ask, which is great. We're all on the same page, and I know we're running short on time. So I am going to just do a little bit of a rapid fire of a couple questions. And obviously, we've talked a lot about partnerships in general, and I would like to hone in on this aspect of natural disasters. So, Rebecca and Deborah, your communities have had many disasters to contend with: fires, earthquakes, public health emergencies. So, I would love to hear from the two of you really, what are your proudest moments when you think about how your program was able to make sure that survivor health needs were being addressed?
So I can start, Deborah, if that's okay. There's a lot of proud moments that I can speak about in the last 5 years. One was the East Los Angeles Women's Center is part of what we would refer to as a food desert. There isn't a lot of healthy food options in our community. And if you can go back to the pandemic when there was a food shortage everywhere, I think that a lot of people then understood what it's like to live in a food desert community where you need things, you want things, but they're not necessarily there, right?
Mm-hmm.
Um, the response that the organization had was to call in every single contact that we had, anybody who worked at a hotel. And I'm not talking about the executives, I'm talking about anybody who worked at the hotels, to help us figure out how we can bring some of that food that wasn't being utilized from the hotels
Mm.
into our community. We called in tortillerias, which is tortilla factories. We called in the pan dulce shops. We called in the mercados. We called in any street vendors, anybody who could help us secure food that was not only available, but culturally relevant to our community. Because we said,
Mm-hmm.
if we're going to do this, we're not going to be giving people can of SpaghettiOs, which is great, right? But it's not how we prepare food every day for our families. And so what we did was we figured out a way to secure all of these items and all of these resources for the community. And we actually ended up putting this system in place for a year and a half. We had so much assistance from our community. I'm proud of that. And also during the pandemic, we were contacted by then Mayor Eric Garcetti's office, who asked us if we wanted to participate in an emergency housing response for the Los Angeles area. Now, if I can take you back in that time, or at least in Los Angeles, we were locked down. There was not a lot of opportunity for us to get individuals into shelters. um, and much less move people around. I mean, we were frozen. And so what
Mm-hmm.
our organization was able to do was in 2 days, we erected an emergency shelter at a five-star hotel in downtown Los Angeles. And within 2 weeks, we had 46 families move into 3 floors of those hotels. And then they were there also for a year and a half. And not those particular families, but those 46 rooms were consistently being utilized for that year and a half. One of the fun facts about, and my staff continues to talk about and re-dream about, is that, COVID funds were available in a different way. And so the way that we were able to problem solve for those families in that time was so incredible. There wasn't limitations on you could do this or you couldn't do that. It was just like give them what they needed. And so our teams were
Mm-hmm.
able to really think outside of the box and create like a little mini city. We create with our partnership, with our legal partnership, we had them move into one of the rooms, and we were able to still keep restraining orders going through that process. I mean, it was just an incredible opportunity and opportunity for us to redream, to get back to that point where people give us the money and just say, okay, what does a survivor need, as opposed to these are your limitations and you have to work within this
Mm-hmm.
box. So yeah.
Yeah. Thank you, Rebecca. Deborah, anything that you'd like to highlight, your proud moment?
Yeah, I wanted to mention two. One was within COVID, similar to Rebecca, just trying to function as essential providers and keep the shelter open 24/7, which we were able to do. Um, but we're only able to do that by having um, partnerships with public health. They came and did testing weekly on our site. So they physically came to our site to do testing. You saw our partnership with some of the educational institutions, some nursing students, that we were able to develop a health assessment form through COVID using telehealth and as a way to communicate health needs with our shelter clients. And also working with the City of Hope hospitals with community benefit dollars. We were able to use community benefit dollars to um, to augment some of our services, particularly around IT, because our kids are home too, right? So they're in the
Mhm.
shelter too. So we had to upgrade our bandwidth and cable system in order for them to work at home. We made that happen. It was hard and it was piecemeal. So it wasn't a plan. We just kind of, everyone came together. And again, how important it is. We already had those relationships established, and it
Mm-hmm.
became a matter of, okay, how can we help each other, and then creating something new.
Yeah.
And then the second one I'll just mention quickly, update to one. Yesterday, I went to the open house of Altadena, where the Canyon Fire hit over 12,000 structures in that community. And we opened our first, we're calling it a collaboratory. So we have all been meeting since January, the first week of the fires,
Mm-hmm.
talking about our services, working with our emergency agencies. And although it's been messy and ups and down, we finally have a structure. And we also are going to have a satellite office in the collaboratory in order to provide direct services right there in the Altadena, Pasadena area. To see that open and to see close to 500 people who came through there, just it made me feel like, okay, we got this. We still got a long road to go, but using some of our lessons learned in the past and these new resources of emergency resources that are available to us, we are definitely putting in a pathway for survivors to be able to ensure that they are connected and have access to healthcare and social services, mental health services.
Great. Thank you so much. So before we pop up the evaluation, and we also have a learning opportunity that we want to share with you, I'm going to give Sarah the last word. Really appreciate your bird's eye national view of this work. And if you want to share one strategy that you think is important to implement in health settings to make sure that the health needs of survivors are being integrated into emergency preparedness and response.
Sure. I think healthcare is already at the table when it comes to doing work in emergency response and disaster planning and response. And so, really, the opportunity is there for you to bring our domestic violence partners to the table. They're not always at the table. And so, I think that is really, this is an opportunity. You're already there. Embrace them, bring them along with you, help interpret between the two pieces, and really that collaboration is kind of key to success.
Thank you, Sarah.
Thank you so much, Sarah and Deborah, for sharing all of your wonderful insights today. We greatly appreciate you just taking the time to speak to us on this Health Cares About Domestic Violence Day. As Virginia mentioned, we will be launching an evaluation poll. So if you can please take some time and provide us with some feedback, it really helps us when creating our TTA. And if we can go to the next slide, please. As Virginia mentioned, we do have a learning opportunity. The registration to apply is today at midnight. This is for our community of practice on building health center responses on intimate partner violence. It will be 4 Wednesdays, October 22nd, 29th, November 5th, and November 12th for a 60-minute session in partnership with Health Outreach Partners and Migrant Clinicians Network. When we send you the slides, you'll have the link and information. Anna also shared a link to the community of practice in the chat. We will also be sending out a resource sheet with different offerings we have to assist you in your programming towards emergency preparedness and building partnerships as well. And we can go to the next slide. Thank you so much for attending our 26th anniversary of Health Cares About Domestic Violence Day. If you'd like to stay informed and connected with us, please sign up for our Catalyst for Change at healthpartnersonipv.org or join the Health Team's monthly newsletter at futureswithoutviolence.org/forum-page. Again, thank you all so much and have a wonderful rest of your day.
Thank you.